Members of the public got a first-hand view of locations where confirmed COVID-19 cases reside in Trinidad and Tobago. With the aid of Geographic Information System Mapping, the Health Ministry on Thursday revealed information showing that there might even be cases among the population that have moved from one part of the country to another. Khrystal Wilson has more in this report.
The Geographic Information System captures, stores, analyzes, manages and presents all types of geographical data on COVID-19 cases in this country. Chief Medical Officer Dr. Roshan Parasram said the system is being used by government to map contact tracing, and based on information gathered, it also aids in decision-making by officials of the Ministry of Health.
Its application in terms of the COVID-19 response has been used predominantly for mapping of patients and their contacts, visualizing the chain of transmission, so the actual chain of transmission as well as the potential for spread, spatial and temporal analyses, databasing and querying of information.
Dr. Parasram walked us through two maps provided by the Ministry of Health. The first map reflected information gathered on laboratory-confirmed COVID-19 cases in Trinidad and Tobago as at April 1st.
We see that Tobago has two cases shown on the map. And if you move across to Trinidad, the cases starting on the northwest, there's a cluster along the east-west corridor that leads further down into the Caroni area towards Cuba and Shogunas, and then we see it going along the western border all the way down to Pinal, Siparia, those areas passing through San Fernando.
The second map indicates how positive cases can move around the country unknown to anyone. According to the Chief Medical Officer, while all 90 confirmed cases were not reflected on this map, it does help with understanding how the virus can be easily spread. He said this is where the case of hidden contacts come in. People who are strangers to the carriers of the virus could not be tracked. He said hidden contacts could infect an entire community.
We have cases being contacted by persons who they don't know, and they're moving about freely and continue to do so, and they contaminate that entire area. So let us not use this as a source for the people in the unaffected areas as shown on the map. And don't be complacent. We have asked the country to go on a state of lockdown because we don't know where the hidden cases are going to be.
Dr. Parasram reiterated his call for members of the public to stay indoors to slow the spread of the virus. Khrystal Wilson, TTT News.